Hi, I'm Dr. Stacy Freudenberg. I'm the training director for the Colorado Psychology Internship Consortium. I wanted to take the time to spend some time with you today to go over a high-level overview of our COPIC program, and I'll talk a little bit more about some site-specific training opportunities. We usually do this presentation during the lunch hour, during our full-day in-person interviews, but because of COVID and the way that we have been impacted, we're doing everything virtually this year, and so I wanted to take the time to record this so that you guys can have the information. Thank you for joining me today. Give me just a second and I'm going to share my screen so I can go over my slides with you. All right, as I mentioned earlier, this is the Colorado Psychology Internship Consortium. We are comprised of 3 sites, Bright Future Foundation, which is also sometimes referred to as BFF, Stride Community Health Center, and Eagle Valley Behavioral Health, which is also sometimes referred to as EVBH. COPIC's mission is to prepare and retain psychologists to provide high-quality behavioral health care for Coloradans of all ages. Our training is based on the practitioner-scholar model, so that means that COPIC trains interns to practice as psychologists who are effective consumers of research and who utilize scholarly inquiry to inform their practice. COPIC offers generalist training with the opportunity for specialized elective training that varies across training sites. Our APA accreditation status. So in 2018, COPIC was awarded full APA accreditation status for 3 years. We're currently undergoing a self-study and we're about to submit for reaccreditation, and we anticipate a site visit in 2021. Unfortunately, due to the pandemic, APA is backlogged with requests for site visits, and so these are taking longer than usual. We're hopeful that we'll get one in 2021, but it's possible it might not be until 2022. We're assured by APA that these delays will not adversely impact COPIC's APA accreditation status. All accredited sites will continue to maintain their APA accreditation during this time of the pandemic and the delays that are associated with that. So now I'm going to go over a high-level program overview. COPIC has several required areas of focus that are consistent across all sites within COPIC. So one of the major ones, or the largest one, is clinical intervention. Interns can expect to spend approximately 20 to 25 hours per week engaged in clinical intervention. All 3 of our COPIC sites are currently outpatient settings, and there are opportunities for individual, group, families, and/or couples at these sites. Each site is different in the types of services that they offer and the populations that they serve, so this may vary by site. Service settings may include schools, primary care clinics, shelter, emergency safe houses, office of the district attorney, detention facilities, law enforcement agencies, and school-based health centers. All right, another required area of focus is consultation and systems collaboration. Interns are engaged in this approximately 5 to 10 hours per week. And in the process of this, they learn about community health and human service agencies, as well as how to effectively collaborate across these systems. So some examples of that are collaboration with schools and other healthcare professionals, as well as other professional disciplines such as educators, social workers, and medical staff. For example, you might find that you are providing consultation services to agencies. I know here at Bright Future Foundation, our interns are engaged in consultation services, trauma-informed consultation services with child protection, as well as a few other local agencies. This also might look like providing workshops and co-facilitating workshops for community partners as well. Psychological assessment is another required area of focus for all COPIC interns. They dedicate approximately 5 to 10 hours per week with this area of focus. Assessment experience is provided at each consortium. However, the types of assessment vary by site. Interns at every site will be expected to administer, interpret, and provide a written synthesis of psychological measures. These assessments may include cognitive, achievement, personality, immigration, mental health evals, and/or competency-based measures. While each site varies on the number and type of assessment, interns will complete a minimum of 8 batteries throughout the course of the year. Required area of focus, supervision and leadership skills. So interns dedicate about 2 to 4 hours per week to this area of focus, and that means that they supervise at least one junior level clinical student throughout the internship year. Internships receive individual clinical supervision as well as didactic trainings on the provision of supervision and leadership. And finally, the last required area of focus is our elective focus area. Interns dedicate approximately 3 to 5 hours per week to this area of focus. All sites offer the opportunity for elective focus areas, however, they do differ across sites. Generally, I would say that interns complete between 1 to 2 elective focus areas, and these projects are determined by specific interests of the intern, community need, and agency capacity. All right, so supervision. One licensed psychologist serves as a primary clinical supervisor at each consortium site. Interns receive a minimum of 2 hours of individual supervision each week from their primary supervisor, which I mentioned before is a licensed psychologist. Supplemental weekly individual supervision is provided by supervisors of elective focus areas and experiences. All interns will receive a minimum of 4 hours per week of supervision by an appropriately licensed and credentialed mental health professional. In-person trainings. COPIC interns meet in person as a group at least 6 times during the training year. For example, we meet 3 times a year, both the faculty and the entire intern cohort for multi-day training opportunities. The first of which is orientation at the beginning, and then we do another one mid-year, and we do an end-of-year graduation as well. Additionally, interns meet as a cohort for several training opportunities throughout the year. So one of the ones that's been consistent from year to year is we have a postdoc symposium that's offered in Denver. And so we allow interns the opportunity to meet as a cohort and attend the postdoc symposium as a group. Benefits. So the stipend for all COPIC interns is $28,000. Funding for various conferences and training related travel expenses are also offered. So we have conferences that interns are, they generally attend, and sometimes they're out of state. So if there was any airfare or lodging or meals associated with those training expenses, you would be able to get reimbursed for them and or have them funded by your agency. Each COPIC site offers PTO, sick time, and health benefits. These, the specifics of these vary by site. However, every intern is offered the same benefits as any incoming first-year staff member would be. And then we also offer 3 days of leave for dissertation maintenance. So there's an extra 3 days of time off, essentially, for professional development / dissertation maintenance. So I'm going to go into a little bit more detail about each of the COPIC sites. The first of which is Bright Future Foundation in Avon, Colorado. I am the site supervisor for Bright Future Foundation, and we are a nonprofit for serving as survivors impacted by gender-based violence, interpersonal violence, domestic violence, child maltreatment, sexual assault, stalking, human trafficking, dating violence, bullying, and acute, chronic, and cyclical abuse. Just in case you're not aware, Avon, Colorado is in the Vail Valley area, also known as Eagle County within Colorado. So we're about, I would say probably 80 miles west of Denver. And we are smack in the middle of the mountains in a resort community where we have a lot of skiing and snowboarding during the winter months. Some more on Bright Future Foundation. We offer behavioral health services for survivors of DV and sexual assault. This includes adults and children. I would say that the caseload for interns year over year of children and adolescents is about 10 to 15%. So we primarily serve adults. And it's primarily individuals. There are the opportunities for interns to create groups if they so choose and run groups as well. and sometimes occasionally work with families. Generally, this is in the context of working with children. If you're working with children, it just is best practice to also work with their parents or their families. So that's usually when that shows up here. Assessment is another portion of the intern experience here. We offer immigration mental health evaluations. So we work with survivors who are victims of violence often, and many of these individuals may qualify for immigration status and a visa through the U visa or something like a VAWA visa or a T visa. And so we provide immigration mental health evaluations to assess for the impact of trauma and also tell their story. So this is usually about a 5-page report, and it helps bolster the case with immigration for them to be able to stay in the country legally and gain a visa status. We also offer learning disorder testing. So we get referrals from academic centers where we're looking at referrals primarily related to ADHD or any kind of learning-based disorder. We also offer opportunities for leadership, so supervision of a junior level clinical extern is a focus here, and consultation and community collaboration. So as I mentioned earlier, interns are our trauma-informed consultant with Child Protective Services, as well as Speak Up, Reach Out, which is our suicide prevention program here in Eagle County, and SART, which is the Sexual Assault Response Team, which is primarily composed of the District Attorney's Office, as well as the Sheriff's Office. And then the intern generally selects 2 elective focus areas. Again, it's possible to do only 1 or maybe do 3. It just really depends on the scope of the project and how much time and capacity the intern has. All right, so now I'm going to talk a little bit about Stride Community Mental Health Center. Stride is based in the Denver metro area, and they have clinics throughout the Denver metro area. They are a community mental health center and also a 501c3, as well as a federally qualified health center. And they have a 30-year history of providing primary care, dental, and behavioral health services in a community-based setting. They were established in 1989 and serve the needs of medically underserved, refugee, and uninsured populations in suburban Denver. They reach the largest number of underserved individuals in Colorado and has the largest population base of any community health center in the state. Stride follows an integrated model of care with the goal of providing high quality, comprehensive, culturally competent primary care, dental, pharmacy, behavioral health, health education, care coordination, and patient navigation services to traditionally underserved populations, thus reducing barriers to care. Clinical intervention in an integrated community health setting, such as exam room consultations and brief individual psychotherapy with patients across the lifespan. Collaborating with an interdisciplinary team of medical providers, so MDs, PAs, NPs, CNMs, dentists, nurses, support staff, and other providers. And then also they have the opportunity of supervision of junior level practicum students as well. The primary supervisor for that particular site is Dr. Carlin Gordon. And at the end of this presentation, I'll give you guys the contact information for each of the primary site supervisors. So if you have site-specific questions that don't get answered during your interview or any of the other collaborative opportunities such as the town hall or the intern meet and greet, you can reach out to the different primary site supervisors to ask those questions. Eagle Valley Behavioral Health, also known as EVBH. The primary clinical site within Eagle Valley Behavioral Health is Colorado Mountain Medical, which is a primary care clinic. They have offices in Vail, Avon, Eagle, and Dillon, Colorado. Again, EVBH is a neighbor site to Bright Future Foundation, so we're located in the same area of Eagle County. We're in the Vail Valley and home to 2 ski resorts. Our mission is to provide exceptional, integrated, patient-centered healthcare to meet the needs of people who experience barriers to accessing healthcare regardless of their ability to pay. The EVBH internship coordinator is Dr. Casey Wolfington, and the Colorado Mountain Medical primary supervisor is Dr. Jenny Hancock. So at Colorado Mountain Medical, the intern can expect to be focused on integrated primary care, outpatient therapeutic services, which include individual, couples, family, and group, Group work includes outpatient as well as IOP. And the focus is working with children, teens, and adults. As mentioned previously, they have a multidisciplinary behavioral health team that includes 8 behavioral health clinicians, 1 psychiatrist, 1 mental health nurse practitioner, 2 behavioral health navigators, and 1 pain management / addiction specialist. So that concludes our presentation for today. I really appreciate you sticking with me. If you have any questions, you can reach out to the following site supervisors. If you have site-specific questions, so for Bright Future Foundation, that would be myself, Dr. Stacy Freudenberg. There is my email address, and then Stride would be Dr. Carlin Gordon with her email address. Eagle Valley Behavioral Health is Dr. Casey Wolfington. And if you have any overall COPIC questions, you can send those to myself. And again, there's my email address for that. So I am going to let this slide sit for just a second so that everybody can write down these email addresses if they need them. We very much look forward to seeing you on your interview day, and please don't hesitate to reach out if you have additional questions that aren't answered during your interview. As I mentioned, we also have the town hall opportunities where you'll be able to meet ancillary staff that we work with in different programs, and they can answer questions and hopefully give you a better sense of what the culture is like at the different respective sites and as part of COPIC too. And then we have 2 intern meet and greets that we're offering where you can meet our current interns and ask them questions as well. So I hope that you will join us for all of these, including the interview. And I hope that this information was helpful and useful, and yeah, reach out if you have any additional questions. Thank you. Bye.